Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is having a say in your care, how to make advanced care planning work for you. Presented by Tammy Turner and sponsored by Prince George's County Government and the Department of Family Services.
Want to spend some time talking about how to make it work for you. And I always like to start off a session with an agenda because I think it's helpful to have an overview of what we're going to be talking about today. Gives you some idea of where we are in the presentation. So we're going to start talking a little bit about Care Prepared as an organization, who we are. Then I want to just jump in and talk a lot about advanced care planning, get really into some of the definitions and terms, talk about who benefits from it, who needs it. And then we're going to spend the rest of our time together covering the D section, I like to call it. So we talk about discussion, discovery, documenting, and we're going to talk about electronic options for that. Want to spend, especially with this group, some time on a dementia directive and what that is and how that can be helpful. And then we're going to wrap it up with the topic of direct and do it again. Who is Care Prepared? And how did it come to be? So Care Prepared is a nonprofit organization that was founded in 2023. We actually started then, but didn't get our website up and running and really going full throttle until this past December. So we've only actually been live to the public since December of 2025. Or 2024. So we're very excited about what we've accomplished so far and what we're going to be able to do in the future. So we're all volunteer, as I mentioned, nonprofit based in Anne Arundel County. And our goal really is to make it easier for people to talk about, learn about, and document their healthcare plans before a medical crisis. And that's for all individuals, and especially those that may have a life-limiting condition, to really understand what options are and make those decisions before they need them. And our vision then is to break down some of those healthcare barriers to enable all people, especially those from underserved populations who have a life-limiting illness or condition, to receive the end-of-life treatment that really matters to them. So matching, you're going to hear me say this multiple times tonight, but it's all about matching the healthcare treatment that is received with the values and goals a person has. This nonprofit was actually my capstone project, and it really evolved because of my own personal experience dealing with my parents. Both my parents were planners. They thought they had everything figured out, documented. They were very proactive with all of that information. And yet, when my dad had a health crisis, my mom was actually his person to speak for him. We're going to talk a little bit about that, but she was his healthcare agent, and she was the person that made decisions for him when he couldn't. And she had to step away from the hospital, and the medical team came to me and asked me all sorts of questions about care that my dad had options for that I didn't know what he would want. And it was such a hard place to be, to make those decisions, to think about those things when you're already in a very stressful, heightened situation. So, I walked away from that really having a deeper understanding that there's a lot of misunderstanding, a lot of lack of options for getting the information out there, and really just, wanting to try and make that better. So we're going to start with the overall topic, which is called advanced care planning. And I think sometimes we're going to talk about some of the definitions under advanced care planning, but sometimes this gets a little confusing because, you're what does it actually mean? And the talking about advanced care planning is actually a process. It's not just one thing, it's several things. And as I mentioned before, the beginning part of it is where you're learning about the different options you have, you're thinking about it, the type of medical treatment you would or wouldn't want in a health crisis, and then also identifying who the person is that could communicate for you if you were unable to. So those are the two key pieces, is learning about, talking about, documenting what kind of treatment you would want, and then who the person is that could speak on your behalf. So the goal then of doing this process, this advanced care planning, is to make sure that people get the medical treatment that is consistent with what matters to them, their values, their goals, their preferences. And this is during that serious end of life type of situation. So it's really important if somebody has a chronic condition, a serious health illness. It's important for everybody. We're going to talk about that. But just to be aware that the advanced care planning process is just that. It's a process. It's not just one thing. So we're into our term section, the definitions. I think part of the reason that advanced care planning can sometimes be a little bit challenging is that there are multiple terms used to talk about the same thing. So for example, the first piece of what we're talking about tonight is called advanced directives, and that's under the advanced care plan, but it's sometimes called living will as well. So all of those things, an advanced directive or living will, those are the same thing. What it is a written legal document that explains the medical treatment that you would or wouldn't want, the interventions, healthcare interventions that you would want if you had a medical emergency. So in the state of Maryland, that written document must be signed, dated, and witnessed by 2 individuals. It does not have to be notarized. It does not have to be created by an attorney, although a lot of attorneys do create them for folks when they're doing their regular wills and any other estate planning. It does not have to be done. You can actually, we'll talk about some resources in a little bit of where you can find advanced directives and create them yourself. So just know that advanced directive, living will, same thing. So the other piece within that advanced directive that I mentioned before, in addition to identifying and writing down the type of intervention you want, is to write down and identify who could speak on your behalf. So that person has there are a lot of different interchangeable terms for that person. In Maryland, we call them a healthcare agent, but you'll sometimes hear that person called a durable power of attorney for healthcare, a healthcare proxy, surrogate healthcare, healthcare power of attorney. There's a lot of different terms for that person, but just know that that's the individual who would carry out, who would be able to speak and understand and know what you would or wouldn't want if you couldn't do it yourself. The final piece that we're talking about tonight that's part of that advanced care plan, you have your advanced directive, you've named your healthcare agent. The final piece is the medical order for life-sustaining treatment. That's sometimes called the MOLST, M-O-L-S-T, MOLST form. So that is a portable, it's a medical order. It is signed by a physician, a physician's assistant, or a nurse practitioner. Those are the only 3 providers that can complete the MOLST form. And it's very specific, and it's for the here and now. It's what is followed if you're in an emergency room, or if you have an EMT, that you have some sort of health crisis and the emergency medical technician or emergency medical responders come, they only follow orders from the MOLST form. So we'll talk about the MOLST form a little bit more, but just realize that that is a medical order, and that's for the immediate, what's happening right at this moment. The advanced directive is sort of bigger, it's bigger picture, bigger thinking, and then the most form is right here and now. So who needs advanced care planning? Honestly, anyone over the age of 18, any adult, regardless of their health status, could benefit from having at least, at the very minimum, identifying who their healthcare agent, who that person that would speak on their behalf if they couldn't, would be. Because, you know, while anything could happen to any of us at any time, it's nice that we have the option to identify who could carry out what we want. You know, sometimes it would be our child or our parent or a family member, but sometimes families aren't necessarily somebody's best choice, and they might have somebody else closer to them, like somebody from their church or community center. So that's one of the most important reasons to have an advanced care plan, at least identifying who your healthcare agent is that it gives you the option, the power to be able to identify who that is. So all adults could benefit from doing advanced care planning, but it's really important if somebody has a serious illness or multiple health conditions, somebody that might be at risk for cognitive decline. The earlier that you can create these advanced directives and start talking and having these conversations, it becomes more and more helpful. So exactly what does advanced care planning do to help? One of the biggest ways is that it really empowers individuals and their caregivers, again, to align what matters to them with their future medical treatment. You really get the option to say, yes, I want this, no, I don't want that. And it's very helpful, especially if these conversations start early and they're had multiple times. I mentioned my own personal experience. It really can help reduce the emotional burden related to making healthcare decisions. If someone's in that position and has to make those choices, understanding and knowing what the person wants just gives that relief and takes that level of stress off of the caregiver or the person who's making the healthcare decisions. And finally, there's the decreased need for unwanted and unnecessary treatments and hospitalizations. You know, a lot of times folks don't know what they don't know, and you get all of these interventions, medical interventions, and it's in the hospital and it's impacting a person's quality of life. They may be living for an extended period, but their quality just, you know, they're in the hospital, in rehab, back in the hospital, the quality of life can really take a hit. Okay, we're on to the B section that I talked about in the agenda. The first thing that I like to share, resource that I like to share, is having conversations. That can be the trickiest part, and I'm really appreciative of the work that the Conversation Project has done to make having these conversations easier. They have a conversation starter guide that gives tips and tools and language to use and prompts, and it's basically a workbook that you can download for free. All of the resources that are in this presentation are linked. I'll make sure that, Brenda, you get a PDF version that can be shared with any of the attendees to be able to access any and all of the resources that are in today's presentation. But the Conversation Starter Guide is such a great tool, a good place to start, and they actually even have additional resources for families who have someone with dementia. So I always recommend using their tools and their free resources because they can be really helpful and a great place to start. This is, we're coming up on the holiday season, so Thanksgiving, I know, might seem kind of weird to think about talking about some of this stuff, but it's a really good opportunity when you get all the family together to start having some of these conversations, and just, you know, it's not a one-time conversation, but maybe just start the ball rolling a little bit. So one of the things that we as individuals who navigate our healthcare system have to do is a little research and a little discovery. So for advanced care planning, it can be really helpful to use a couple of different resources. The one I like from the state of Maryland is from the Maryland Department of Health, and it's called the Maryland Advanced Directive Program. Again, it's linked in this PowerPoint. It's a great program that provides, again, specific information for Maryland, a lot of additional resources about when you want to name your healthcare agent, like some things to consider. So I really do think our Department of Health for our state has a lot of great information regarding advanced directives. The other site that I like to refer people to is on the National Institute on Aging's website, and they have advanced care plan tips and tools and resources as well that are super helpful, especially for older adults, but just their overall information is really well done as well. Okay, so you've had the conversations. You've done some research, you feel pretty confident now about what advanced care planning is, what to do with an advanced directive. The next step is to actually document your decisions. So a couple of tools that we like to share. One is through 5 Wishes. 5 Wishes has a really nice booklet that has it's a legal advanced directive in Maryland, and it's using very common, easy to understand language to create your advanced directive. It has 5 wishes. The first wish is identifying who that person is that could speak on your behalf. So that's naming your healthcare agent. The second goes into what kind of medical treatment you would or wouldn't want. The third talks about how comfortable you want to be. 4 is how you want people to treat you. And then 5 is what you would want your loved ones to know. So it goes into these 5 areas, 5 wishes. And the other piece I really like about the tool is that it gives prompts to kind of help you think whether or not you would or wouldn't want some of these things. And if it doesn't apply to you, then you just cross it out. But if it does, you leave it as one of the options. So for me, when I was working on mine, I liked that it had things already written out that I could just kind of say, oh yeah, that's true. That would be really important to me. And then it also provides space, free space, extra lines for you to document and write anything else that matters to you to include, to make sure you include on that. So we really appreciate the 5 Wishes tool, and know that it's a legal, again, it's a legal advanced directive in Maryland, and the language on it, ability to utilize it is really helpful. The other form up here was, I mentioned it briefly, and that is that medical order for life-sustaining treatment. So it is a 2-page form. In Maryland, there used to be a document called a DNR form, or Do Not Resuscitate form. This form has taken that and expanded it. So the first page is all about CPR and resuscitation through CPR. So it is really, really important if someone does not want CPR to make sure they have this, at least this first page filled out. And again, this is the form that is created and documented by a physician, a nurse practitioner, or a physician's assistant. It can be received at a provider's office. You can have a conversation with the provider and ask their opinion based on your health status, whether or not what they think how you should answer these questions. But again, if you do not want CPR, this form's really, really important to have. The second page is it's an optional page. It goes into more of the specific instructions for what somebody would or wouldn't want in the event of a very serious illness or end of life situation. There's options such as artificial ventilation, blood transfusions, artificially administered fluids and nutrition, dialysis. It has a lot of different options on that back page. Again, the first page is what's really important. Only if someone does not want CPR. The second page, it's good to be aware of what all these interventions are and have a conversation with your provider and kind of think about things you would want or wouldn't want, but you don't necessarily have to have that second page filled out. Some of the folks on our board, nurse practitioners and lawyers, advise that second page could be left open and then have a conversation with your healthcare agent and let them know what your preference is, and then they can, in the moment, make the best decision for you based on what's happening with your current health status. So those are the advance directive, and again, we like to use the 5 wishes because we feel it's super helpful in easy terms, and then the Maryland MOLST form. And again, we've got links to everything in this presentation. So the one thing I wanted to make sure you guys were aware of tonight too is Maryland has an electronic version of an advanced directive that's free, and it's called the Maryland My Directives program, and it is very user-friendly. It is free, as I mentioned, and it is connected in Maryland to all of the hospitals through the health information exchange called CRISP. So it can be way easier accessibility to any provider that would need it. In addition, when you create your account and you create this advanced directive online, you can share it with other providers who might not be on that CRISP system. There are other health electronic records that sometimes they all don't talk to one another, but if you create your advanced directive in the My Directives portal, you have an option to share it with other providers, to share it electronically with family members. You can, share it with whoever you think might need to have access to it, and it's way nicer to have one spot to have everything on. You can upload documents that you've already had filled out, and as I mentioned, so it's one place where everything is stored, and again, it's electronic, easier for people to access from the health systems, and just better than having a printed copy somewhere that people might not know. It's either in your fire safe or somewhere that in that pile of bills. This just makes it way easier to store everything and make it shareable. The other tool that we wanted to make sure you guys are aware of, Care Prepared partnered with Compassion and Choices to create a Maryland-specific dementia values and priorities tool. So Compassion and Choices created this tool, and then we were able to modify it to be compatible with what Maryland's language is and make it accessible to those here in Maryland. So it is an online interactive tool. It is helping someone with a dementia diagnosis create an addendum to their overall advanced directive. It helps guide through some questions, some thoughts regarding treatment specific to how a dementia diagnosis progresses. So it's really easy to use. You can take your time on answering the questions. It's an online tool, or there's options to download a PDF version on our website, either in English or Spanish. The online version I really like because, again, it's easy to navigate. The questions are very open-ended, very basic. If someone doesn't understand some of the terms that are used in the questions, they're highlighted in blue, and you can click on the highlight, and a little video pops up to give the explanation. So you go through, you answer these questions, and at the end, it basically comes up with a report, which is your then dementia directive. You download it. It does not save on our website. It becomes your personal addendum to your advance directive. And it's, again, just very specific to a dementia diagnosis. So we're very excited that we've been able to work with Compassion and Choices to have this tool available to those living in Maryland. All right, we are coming to the end here. Couple of things to really remember is the direct. So it's awesome to do all this documentation, to get everything written down, but people really need to know where it is. That's why we definitely like that My Directives platform, because electronically it can be shared with others. But if you do just have paper copies, it's really important to make sure at least your healthcare agent knows where those are. The other direct is to identify who that person is that could speak on your behalf. So that healthcare agent, make sure you have a conversation with that person, ask if they're okay with it before you document. We could spend time talking about, some of the things regarding how it's helpful to figure out who the healthcare agent is. It doesn't, sometimes people feel like it has to be their spouse or significant other, and it doesn't have to be. It can be whoever you think is going to be your best representative in a crisis situation like that. And then finally, we have the do it again. So this topic, this advanced care plan, is not, as I mentioned, it's a process. It's not just a one-time thing, especially as we age. It should be done annually. Revisit it. Are things still the same? Are your options? Do you still want the same decisions? Have things changed? Have you thought of something, addition that you wanted to add to your advance directive? It's also important to update if your health condition changes, if you get a new diagnosis, if there's a divorce in the family, or if there's a death. Any of those sort of changes in a person's life really kind of are a red flag to say, hey, let's revisit doing the advance directive and check and make sure that everything is still where we want it to be. Okay, we have gone through all of the slides, and we are now at the question portion, and I'm happy to answer any questions that you guys may have.
Tammy, I don't think we have any questions.
Okay, yeah, I'm not seeing anything. Well, our contact information is on this slide. If anybody does have questions that they think of later, we are open to answer anything and be as help in any way that we can. We do, our website is just, our website is bilingual in English and Spanish. We try to make sure all of our printed resources are also bilingual and are happy to share those with anyone that needs them as well.
I do see a question. It says, how soon should a person create their most form if they're over 60?
So the most form, if you're over 60, the most form, again, is really important if you do, if personally, if you do not want CPR. If you do want, if you were to have a medical emergency and you say, oh yeah, I want, you know, I want somebody to definitely perform CPR on me, I want that, then you don't need to worry about doing the MOLS form. It's still important to get the other advance directive, get your other thoughts and wishes documented. But that MOLS form is really important, again, for like the here and now, if somebody does not want CPR to be performed.
Thank you, Tammy. I think that was the only question we have.
Okay. Okay. And again, I think that form is really, it's helpful to talk to your provider, whether that's your primary care, whoever, you know, is your primary provider, to talk about your own health status and what those interventions are. And those conversations can be had with your medical provider and covered under Medicare insurance. So they can bill for advanced care planning conversations under the Medicare program. And then we also, if anybody ever wants, we do personal consultation for a small fee as well, if people have additional questions.
Thank you, Tammy.
Yeah.
All right. Well, thank you so much for all the information you gave us tonight. I think they got a lot of information that is very helpful. Even with the most form, I I have heard about it a lot. I knew that it was about your decisions as far as your care, but I didn't know that the most form in specific was just for not wanting CPR. I thought it was all of the advanced directives.
Yeah,
And
I mean, it does, yeah, it does have the other, like, actual interventions on the flip side of it. I think it's just, I think a lot of people aren't aware of the importance of it, just from a, like, oh, I didn't know that if I don't want intervention, you know, any CPR intervention, I need to have that filled out. If somebody could have completed their advance directive, but not completed their MOLST form. And it's the MOLST form that the medical providers and the EMT crews are going to be following. That's you know, the way they're instructed.
okay, yes. Yeah, it's important to know the difference, and yeah, that's all helpful.
Yeah.
No, and especially right now, I think it was a great point for you to bring out the fact that they should be talking about it now that, they're able to bring the whole family together over the holidays. Uh,
Yeah.
yeah.
Yes, I highly encourage. I mean, one of my board members and I were talking to, doing another interview, and she's the one that brought that up. She's like, yeah, grab your 5 wishes and start talking at the Thanksgiving dinner table. And the person interviewing us was like, wait, what, really? And it's like, yeah, I know it seems kind of, it could be, feels like it might be not the right place, but it really is. It's the place where everyone's gathered together. It's a place where, you could at least start having these conversations. And again, the Conversation Project resource gives some really good language to use to start the prompts to break the ice about it.
Yes, and I know you said that that you have bilingual information on the website, but for consults, like if someone wanted to talk to you or someone on the team about this, are there staff that speak Spanish too?
Yeah, everybody is volunteer in our organization. We have one, and she's actually part of the DFA, Prince George's County. Miriam Rendon Ponce
Oh,
is one of our, yeah, she's one of our board members.
oh,
Um, not easily accessible, but we could make it work, right? Like we could definitely connect somebody with someone who speaks their language.
oh, perfect. Yes, that's good. That's good to know. Um, yeah, I think that's it for tonight. But thank you so
Okay.
much, Tammy, for everything. Like I said before, we are going to upload this video on YouTube. So if anyone needs to rewatch this, feel free to go to our YouTube channel, okay?
Awesome. Thank you.
No problem. Enjoy the rest of your night.
You
Good
too.
night, everyone.